Hey everyone, my name is Keegan Marchand. I'm a fourth year medical student at UBC, and I'll be pursuing family medicine in a couple years.
My name's Miles Marchand. I'm a physician and member of the Okanagan Indian Band, and I work in the intensive care unit at Royal Columbian Hospital.
And my name's Noah Marchand. I'm a family physician right now, just finishing my residency in Victoria.
So from my personal experience working in the intensive care unit, I've seen hundreds of people admitted to the intensive care units with coronavirus, and many people have passed away, and I've seen lives destroyed. I've seen families and communities that have been destroyed. I've seen family members who can only say their goodbyes over an iPad or through a window, and who are unable to say goodbye to their family members as they'd like to. And this virus really is devastating, and I think vaccines are so important to avoid this condition and this infection. Since the vaccine has started rolling out, there's only a few patients left in the intensive care unit at the hospital I work at, and there used to be over 30 patients at a time, with the intensive care units overflowing. And so the vaccines are working very well. They have a high efficacy, and they avoid people getting very sick and going to the ICU and dying. And that is the way that we can keep our community safe.
Yeah.
You guys, I mean, I can talk a
Yeah.
little bit.
Yeah.
It's up to you guys.
No, I'll try to take this one. Yeah, so the way that the vaccines work is when you get a vaccine, you're not only protecting yourself, but you really are protecting your whole community. And it is a topic that some people have said of herd immunity. And that basically means that if a large enough number get it, that still protects the people who might not be able to even get the vaccine, whether they have a medical condition that prevents them or other reasons. So that's it. Sorry.
Yeah.
So it's more than just you're just
Yeah.
protecting yourself, basically.
Exactly,
It's
yeah.
important
And so the people who can't actually get the vaccine, you're protecting those people as well, right? And a lot of times those are people with medical conditions as is who would be at risk if they did get COVID. Whether that's our family members or elders in our community, it really does go a long way for not only yourself but for your whole community.
The
Beautiful.
larger proportion of the community that's vaccinated, the lower the chances of large foci of spread, and if there is an outbreak, it'll be less numbers and less people affected overall as well.
And I think really when you get the COVID vaccine, you protect yourself, but you also protect your family and you protect your whole community. And I think it's if you're able to get the vaccine, you certainly should. It's so upsetting to think that we're not listening to science and medicine and people who we all we go into the field to try to take care of people, right? And then it's very upsetting to think that misinformation has spread to the point that it's killing people. It truly is. And I've seen so many horrific things that when I hear about people who are misinformed, it's tough to hear about, because I've had horrible experiences, and I've seen so much pain over the last couple of years that and I mean, some of it is not to anyone's fault. I think the important thing is to inform everyone so that people know, if people are informed, I think people will make the right decision, which is to get the vaccine. So I think this type of project is so important to reach communities that might not be as well reached, right? So I think hopefully things like this can move everything in the right direction. Because we've seen in the Kashechewan First Nation right now, there's 125 cases right now, just over the last week, and most of those are kids, and it's just not where we want to be right now.
I think for the youth as well, I think as a youth sometimes it's easy to kind of feel invincible, and especially with something like COVID, where I think most of the things you hear about in the news are, you know, folks who are a bit older than you that are getting really sick. And if you're not kind of scared about yourself getting sick from COVID, I think look at your grandparents, look at your elders, your parents, and those around you, and it kind of comes back to that topic of herd immunity and protecting those you love and everyone around you. It's not just for yourself.
I think it's equally, if not more important, for young people to get vaccinated. For young people, you're at a time in your life when you want to be out, you want to be hanging out with your friends, and the way to safely do that is to get the vaccine, which will protect yourself and others around you. The vaccines have been studied in great detail, and they are safe for people as young as 11 or 12. And more studies will be done and are currently being done that may allow us to vaccinate even younger people. But we always are going to be make sure we have all the information before we decide to vaccinate anyone. And we have such a wealth of millions of people who have been vaccinated at this point. And we have all the information about the outcomes of those patients, and they're very positive. So we have rapidly declining amounts of COVID, rapidly declining number of deaths, and a very few number of side effects as a result of the vaccine.